Further grievances, member for Kalgoorlie.
Mr Speaker, my grievance is to the Minister for Health, and it's in relation to the Menzies nursing post. And unfortunately, residents of Menzies can't be in the chamber today, but that certainly doesn't diminish the importance of this issue to them. And I want to thank the Minister for Health for giving me the opportunity to raise this issue. The Menzies nursing post has been without a permanent nurse since February 2012. This week, over 60 residents of the town of Menzies and surrounds met to express their frustration that there's no permanent appointment been made since that time. Of the residents who attended the meeting, I'm told around 40% were Aboriginal people who live in and around Menzies. Many Menzies residents do not have the mobility to allow them to go to Kalgoorlie over 130 kilometres away to seek medical attention. The Shire of Menzies covers a total area of 125,000 square kilometres and has an annual revenue of $1.4 million. There's a total population of approximately 400 people, with around 150 living in the town and another 75 in surrounding communities. This is as of October 2010. Menzies has been blessed over many decades to have nurses who have called the region home. Janet Mazin, known to the locals as Sam, served as the local nurse for many years, and prior to her the region was served by Kath Finlayson, a local pastoralist. Since Sam finished at the nursing post, the town has been serviced 3 days per week for 2 weeks out of 3 by a silver chain nurse driving from Kalgoorlie, which is 160 kilometres away. Then, on the 31st of January, residents received notification that from the 11th of February 2014, the service would be reduced to 1 day per week until further notice. Minister, this is not good enough for a small community that is over 100 kilometres from its next nearest town. I first raised this issue when I was a member in the other place at the Estimates and Financial Operations hearing on the 7th of June 2012, when the then CEO of the WA Country Health Service, Mr Ian Smith, gave the assurance that the problem would be solved. He said, "We have a drive-in, drive-out service at the moment which is not satisfactory for anybody, and we have to find a solution to getting long-term permanent appointment there." I also raised the issue with the regional manager of WA Country Health Services and been told that it would be difficult to recruit a nurse because the accommodation was attached to the nursing post, and therefore the nurse would be disturbed by people knocking on the door 24/7, and that this would be a disincentive to filling the post. On the strength of that, I wrote to the Minister for Regional Development in July 2012 to seeking a solution to the housing problem, and received his response in September saying that the department will work with the WA Country Health Services to obtain vacant possession of a grow property that will assist with the recruitment. This was great news, I thought, but still no nurse for the Menzies nursing post. My continual inquiries with the WA Country Health Service were always met with the answer that no one had applied for the job, and yet I've been provided with anecdotal evidence that some people have expressed an interest in the position and been told there was not one available. I wrote again to the Minister for Health and Minister for Regional Development in October 2013, stressing the importance of staffing the post, not only for the locals, but also for the significant mining and tourist traffic on the busy Goldfields Highway that passes through the town. The famous Lake Ballard statues are in the Shire of Menzies, and already the very overstretched single St John ambulance volunteer has had to deal with some very difficult situations due to the lack of a nurse at the post. Menzies is also the local town for the new growth area of the Yilgarn Iron Ore Province, where several mining companies are well advanced in developing reserves which could produce an additional 10 million tonnes per annum. The construction stage is estimated to bring 1,000 workers, and the operational stage will employ up to 360. Some of these will be resident in Menzies, and most will be passing through that town. The Shire of Menzies is planning for considerable expansion in the town, including accommodation for up to 40 workers, and yet I've been told that even if this occurs, it will not be sufficient to trigger the employment of a full-time nurse for Menzies. Minister, salt was rubbed into the wound when I received a briefing note from the Premier's office in December last year which stated, "Currently, there is no shortage of nurses in Western Australia." Even though it's not their core responsibility, the Shire of Menzies has offered to contribute cash and incentives to the recruitment of a nurse for the post, but there always seem to be impediments in the way of solving this situation. The Kalgoorlie Miner summed it up in an article on Thursday the 17th of October when they described a town living in fear of a serious accident occurring on the highway, a nearby mine site or pastoral station, or the popular Lake Ballard route when they did not have the resources to respond. Like any other West Australians, Minister, the people of Menzies have the right to reasonable health services, and I ask that every effort be made to place a full-time nurse in the Menzies nursing post. And thank you, Minister, for taking this grievance.
Thank you, Member. Minister for Health.
Mr Acting Speaker. Mr Secretary Speaker, this has been a long issue, and it came about with the retirement of a nurse, Mrs Mazza, who retired on the 29th of February 2012. As the member stated, this community is 130 k's north of Kalgoorlie and 100 south of Leonora, so people who are living there do have a long way to go. There are approximately 200 people in the town. I think about 120 of those are Aboriginal people of Aboriginal descent, and the other 60 non-Aboriginal. And there's 25 children attend the Menzies school. So when she retired in 2012, we advertised for a full-time nurse for Menzies, and sadly received no applications for that position. As people understand, it's a long way away, and conditions, as the member have stated, haven't been all that flash, particularly in terms of accommodation. So then we started having conversations with Silver Chain, and we looked to getting agreement with them to place a full-time nurse, but they did an assessment of the service and the numbers of patients they would get coming, and decided that it wasn't viable, and so that they weren't prepared to be involved in that. So in the meantime, we started what's called a drive-in, drive-out service. So a nurse was sent from Kalgoorlie for 3 days a week, and that service has continued to operate. We also have other services such as public health, child health, school health services are done on an outreach basis. We have a doctor goes there through the Royal Flying Doctor Service once a month, and of course John Ambulance cover that service as well. Mr Speaker, we then looked at what we could do to try and improve that nursing situation, and in trying to work that out, we decided to do a review of the service, particularly looking at what sort of numbers of patients they'd had over the last 2 years, when there was not only a full-time nurse but a part-time Aboriginal health worker who incidentally retired as well last year in 2013. I think concerned about her ability to manage on her own as just an Aboriginal health worker, rather than being having nursing qualifications. So they did that review over a 4-year period, and what they found that the numbers of presentations were very low, mostly servicing people with chronic disease rather than emergencies. Very few emergency called out, and no Category 1. Category 1 are urgent call out for people needing immediate care. So in that 4-year period, very few call-outs, and in fact the numbers of patients were very low. So Country Health Service decided that time, of course, they've got limited resources and have to spread them across a vast area of the state. And so their view was that a full-time position could not be justified, and decided that a 0.6 appointment was appropriate. So in November 2013, so just a few months ago, the Health Department advertised for a 0.6 full-time equivalent registered nurse, and still looking for a 0.5 Aboriginal health worker. And I understand that the Aboriginal health worker who was working there before, who retired, is interested in coming back and working again if there's a full-time nurse, which is very gratifying to hear. So, Mr Speaker, as a result of that, the WA Country Health Service are now out looking for people who are interested in that post. And I'm pleased to say there have been 2 nurses who've expressed an interest. Now, the member talks of some other nurse who said they were interested and was told that there wasn't a position. Well, I'm just not aware of that being the case. I've got no evidence from the Health Department to say that was true. They've been desperately looking for someone to go and work in Menzies. So now we are advertising for a 0.6. The community, as a result of the community meeting they had the other day, where I gather 60 people attended that meeting, and conducted, as I understand, in a very positive and non-aggressive way towards Department of Health, who understood the difficulties. What the Menzies Council have decided, though, is that they are still very keen to have a full-time nurse and have put up a proposal in which they will pay the additional 0.4 to enable a full-time nurse to work there. That is welcomed by Health Department, and my understanding is that the conversations will be had with the two people who have put up their hand, looking for expressing an interest in working in that community. So that is where we're at now, Mr Speaker. The council, the WA Health Service have said that they will support 8.6 in the community. The council have indicated they will support 8.4 if we are then able to recruit either of these nurses that have expressed an interest. Then we, as I said, have a request for a 0.5 Aboriginal health worker, and hopefully the one who was there before, who I understand was very good, will come back and work within the system. So there is a potential way out, Mr Speaker, but it does depend. Very good. Thank you. It does depend on the outcome of the negotiations with the two particular nurses that have expressed an interest. So remember, if you, I'm sure the members, the people who live in that community will be aware of that, understand why they might not be down here in the gallery. It's a long way to come from Menzies, but as you know, I've been there on a few occasions, and despite its size, it's an amazing area of the state, and I think the people who live there are very proud to live there and proud of their community, and quite rightly, when anyone has children, they want to have some sort of health worker in the town, particularly with that interest of Aboriginal people who have high health requirements. Then, as I say, 60% of the population there being Aboriginal. So we will work towards that, and hopefully one of these nurses will take up that opportunity to work in that local community.